Welcome to HIPcast, the Health Information Professionals podcast. I'm Dr. Seth Johnson alongside my co-host, Dr. Shannan Swafford, and we are going to start a journey of a podcast. And today's episode, our first episode, is basically just an introduction of who we are, kind of the process of what we're going to go through, the topics. Maybe we'll talk about kind of how we're picking up topics. But the point of this whole thing, I believe, is just we want to engage the health information industry and the membership of that industry, the professionals of that industry, and provide just content, something quick, 30, 40 minutes that you can listen to of something that's coming down the road from the future or, issues of today even, right? And it should be fun, but Shannan, what have we got ourselves into with this?
Well, you know what? We don't know what we don't know. So I'm not sure yet what we've gotten ourselves into. I am already positive that there's a lot of interest in a health information specific podcast that is looking at today's challenges, but also looking at tech-enabled future for health information professionals. We've had a lot of positive feedback from potential and already committed guests for the show. And
yeah, we're gonna be busy.
I know it's gonna be so fun. And some of the conversations that I've already had just prepping for this with some of the guests, I have been amazed already at the new things I've learned. So, I mean, I don't know what we've gotten into either, but I'm pretty excited about it. I love the unknown about this, I think.
It's a little scary. And, and you're spot on with some of the preparations that we're doing with the first few episodes because, the health information profession is broken up into domains, and a lot of us kind of fit into one or two domains as a primary, and then the rest of them are things we get CEs on and try to stay close to. And some of these things that you were sending back and forth around coding and denials and all this revenue stuff, I'm going to be a very silent partner on this thing because I have no clue what you're talking about. I'm in the technology world, so I'm a little nervous about those episodes. I'm nervous about some of those episodes too. I haven't worked in a provider space for quite a long time, and so some of those things that our guests are talking about, I'm just like, am I going to know enough to ask intelligent questions? Yeah.
That's what I want to know.
Yeah, well, it's a point there around the provider spaces. It's been a few years since I've been in a provider space as well. So we're going to talk to guests that are in the traditional space, in the non-traditional space, like you and I both are. And we want to invite anyone and everyone, I think, to come and tell us how they're using their health information backgrounds to explore this world that we live in.
Yeah, I wonder, speaking of those health information domains, what is your health information journey? How did you get here? How did you get from where you started to here? What's going on?
Oh, that's a good question. So, this would be our introduction podcast. So I guess that's a good place to go is let's tell everybody who we are and kind of the background of us on the health information journey. I went to the University of Tennessee, Knoxville campus at first. So I'm a Tennessee volunteer. If you can't see from behind me with all the Tennessee things. And, that's something that our audience listening to this should know. Shannan and I are both East Tennesseans. So we do have this wonderful dialect that we're both blessed by God with. And that also provides us the opportunity. I tell my kids, you're from East Tennessee. You're allowed to make up words. So during this podcast, you're going to hear words that don't make sense. And it could be a Tennessee word, or it could be just a word that we made up on the fly because we're East Tennesseans. But I was sitting in a finance class at UT in the old business building that they called the spam can because it was shaped like a spam can. If anybody remembers the wonderful mystery meat of spam. And I was sitting in that class looking around, there's like 250 people in there. And I'm like, we're all going to be fighting for the same cubicle. Like, I don't know that I want to go into finance or banking or whatnot. And at the time I was working in the emergency department as a account registration person. And then I was also working in the OR at another local hospital as a third scrub. So I quickly learned that patients are yucky, and I did not want to be a clinician. I'm not going to go down that path of living that world. So I remember going to my advisor there at the UT Knoxville campus and saying, "Look, I really like hospitals, but I really don't like patients. Not necessarily patients, but I don't like patient care, right? I don't want to get into all the icky stuff when it comes to patients, but I think the business side of it's pretty fascinating." And that advisor said, "Have you ever heard of health information management?" No, I haven't. Sorry. And so I started researching it. I went and asked who at that one hospital I worked in the ED. I said, "Who's the HIM director here?" And went and met her, and she was super nice. And she sort of just explained what they do on a daily basis. And I thought, that's kind of cool. I'm going to do that. So I quickly went home and told my parents I'm moving to Memphis because the UT Health Science Center campus is on the other side of the state in Memphis. And told my girlfriend at the time, "Hey, it's been a great few months that we've been dating, but I'm going to move to Memphis and finish my undergrad out there." Luckily, she stuck with me. That's my wife, Kristen. So she stuck through. I think maybe the long distance thing worked out for us because she didn't have to deal with me as much. But
she's still sticking around.
Yeah, exactly. So we went to Memphis, went to HIM school, had a wonderful experience there. And that's kind of where I was introduced into the association stuff. And they were highly encouraging participating in the state annual meeting to go network. I remember going to my first annual meeting as a student, and I had 60 resumes that I had printed out. It was more of a leaflet at that point in my life because I really didn't have much experience of anything. Yeah. So I went around that meeting just handing out resumes and saying, can I take you to breakfast, and would you mind paying because I'm a student and I don't have any money. And it ended up getting a few opportunities out of that meeting. Started in the basement of a hospital as a operations supervisor, managing the scanning operation at a big medical center. And a lot of times we'll talk to students, and hopefully students will listen to this podcast as we go along, but you got to get your feet wet. You got to start somewhere. So I took the opportunity to start in the basement and start scanning and prep and scan and those type of things. I worked my way through, ended up being an operations manager in HIM, up to an assistant director at a different health system, served as a privacy officer at a health system for a little bit. Got my master's degree during that time frame. And then when the Affordable Care Act was passed, and the HITech Act was part of that, I had run a project for the CIO around transcription. Back in the day when we were putting in speech engines, and we thought we were tough stuff. Well, man, nowadays with where dictation and generative AI is going, but back then we thought we were tough stuff with a speech engine. And I remember him calling me and saying, "Hey, you really know about all the ins and outs of healthcare. Like, if we pull these two levers, these three things down the road will break." And I said, "Yeah, I'm a health information professional. That's what I'm trained in." And he said, "Would you come over and be our project management office director and run our EMR projects?" So I thought, well, that's fun. So that got me flipped over into the technology world, deployed a couple EMRs, had a lot of fun during that process. And that leads me to where I work today for a technology vendor that's a manufacturer of IT hardware. And I was a customer of theirs. And I remember meeting some of their management team when I was a customer. And then one of their guys called and said, "Would you join us and help us learn how to better serve our healthcare customers?" And I thought, that's kind of a unique question from a vendor to hire somebody from the industry. And come to find out, that's what they have. They have industry teams that are all people from the specific industries that they provide technology into, and our job is to help them navigate it. And that's given me the opportunity to do it globally now. So I get to travel all around the world, get to look at hospitals all around the world, and it's a lot of fun. And then COVID gave the opportunity for me to get a doctorate. So when we say, I don't like the term Dr. Seth Johnson, I'm just Seth. Just call me Seth. But I do have a doctorate in healthcare administration. So that's kind of led me to my journey. But I mean, let's hear about you, Dr. Swafford. What about you?
Well, first, I want to go back to a couple of things you said. You mentioned the association, and that's really the purpose of our podcast is to support the Tennessee Health Information Management Foundation. And so when he mentioned the association, he was talking about THIMA. And that's our love. It's our state association where we network, we learn, we serve. So I wanted to mention that. But I also wanted to mention, as a Southerner, I'm not supposed to say this, but Seth mentioned spam earlier, and that is disgusting.
What? Spam is so good.
Bologna, I'm in, but spam, I'm out. So
it's the same thing. It's the exact same thing.
Maybe it's the thickness. I don't know. It's pretty nasty. So,
well, and it's a good point that you brought up the foundation, because the state of Tennessee is a little unique that we do have a 501c3 foundation that's a separate entity that is dedicated towards the education and advocacy of our profession. So this, the benefits of this all of it goes to the foundation, which promotes scholarships for students and advocacy for our profession. So we're excited that we're not the beneficiaries, that if this goes to the profession.
Yep. Very good. Very good. My health information journey started probably not that different than you, except that I already knew I didn't want to touch patients. If my people are sick, I will touch them and take care of them. But I think nurses and teachers are special people, and I'm not that special. That's what I believe that, because it takes a special person to actually do physical care for the sick and the ailing and the injured. And I knew I didn't want to do that, but I knew that I wanted to be in the healthcare space. But I didn't really know about health information either. We were like it's unfortunate to say that we've been the best kept secret, because it's still true. I feel like today that, people know who nurses are, people know who IT is, but still a lot of people do not understand who health information is. And so I was looking at the allied health services. My degree I started with just an associate's degree at a local community college, and health information there. The director of the program at the time was Alice Moore, and she was a wonderful, graceful, amazing individual. I probably should have hired her for grace lessons for myself, but I didn't. But sometimes I try to emulate her. But I talked with her, and she really was impassioned about the power of coded data. And this was in 1997 or something, so it was a long time ago, maybe 1996 even. But she was talking about the power of coded data and talked about how diagnosis codes, ICD-9 at the time, now we're in ICD-10, and some countries are using ICD-11. But she talked about the power of those data elements telling the clinical story of a person's disease process or condition, signs and symptoms, and then talked about the procedure codes that associate with some of those encounters or hospital stays. That tell you what happened to a patient during their encounter with the healthcare system. And so the thoughts of being able to be almost like an investigator going through a medical record to pull out and summarize that information in a code, so that can inform research. It can inform who has what conditions in what area, things like that. So for me, what drew me into health information was that power of coded data. And today that still drives my life. I love the power of data. Data is the best asset that in my opinion, that we have outside of human resource. Data is the best asset we have. So I love the data piece. So I worked in hospitals. I worked for a provider's office. But where I started going into the tech side of things a little, just a small introduction, I worked for a provider for a while who had an EMR, was before meaningful use, right? So it was before the requirement for everyone to have them. So it was really a hybrid where you had paper, but you had the electronic. But I will say in that office, the paper was really a super bill. And then any reports that were not easily put into or populated in an EMR. So an EKG, right? An eye input of some kind might be there, but it was really advanced at the time. And I didn't think about it being advanced, but it really was advanced for its time. But I was the kind of the liaison for the EMR to the office. So when there were enhancements or things, I did the training, and it was like a train the trainer. So I got introduced to a lot of the underbelly, if you will, of how that kind of worked. And so then when I left that role, I was so fortunate to have been hired by my good friend Robbie Morris. He worked for the 10 Rec, which was the Regional Extension Center, in 2011. And that was a subsidiary of QSource, which was Quality Initiative Organization for the state of Tennessee at the time. Both of those are very different now. 10 Rec, in fact, is finished because that was a contract and that ended. But in that role, I was able to help Tennessee hospitals that were in rural areas. And so some of them being critical access hospitals, I was able to help them do searches and define what EMR that they wanted when meaningful use became the requirement. So adopt, implement, or upgrade for meaningful use in 2011, 2012. And so I learned so much about tech then that it just helped me take my understanding of data to the next level. And so I've been able to help rural hospitals, critical access hospitals. I've been able to help urban hospitals in a different kind of role, in different kind of roles there. And then I worked for a health plan. I used to whisper, I worked for a health plan. But there's really a lot of value that came from that experience. And I actually worked at a health plan for quite a long time, 8 or 9 years maybe. And I learned couple different roles, but I learned a lot about analytics, fraud, waste, and abuse, and how a health plan kind of tries to counteract fraud, waste, and abuse, which is necessary because unfortunately there is fraud. People are just people. And I did analytics there, but my last experience there at that health plan was to implement an end-to-end data governance program that was enterprise-wide for diagnosis and procedure codes. So how do we consume those as an organization? How do we bring that data in? Then where do we put it? How do we define it? And then how do we flow that out to the enterprise in an efficient way so that all downstream systems get updated, so that all claims process correctly, and so that everybody gets their benefits applied appropriately. So there's a lot of moving parts in that. And then I left that crazy, left my corporate job, corporate security, that I've always had a job with somebody else being responsible to pay me, and started a startup for technology, Center for Health, and trying to help people in rural areas access healthcare virtually with distant providers. And during that effort and trying to get that off the ground, I was introduced to a colleague from a mutual colleague, and we started a new startup. So now I'm into this whole software thing that is driven off of the power of coded health data, and data governance. So it has been, life is crazy. I'm not sure what I'm getting into. Maybe I'm just all about, hey, let's just see what happens, because I'm doing the startup thing and now we're doing this podcast. So let's just be adventurous, Seth.
Amongst other things. And you got a doctorate as well in that
I
time frame,
did,
didn't you?
yes. Oh, listen, I'll tell you at a very high level, I am a late bloomer. I went to college late. So, interestingly enough, and I'm not sure that you even know this about me, Seth, all of my degrees they correlate with a rite of passage for my son. Did you know that?
I did not know that.
Okay. So when my son was getting ready to start kindergarten, I thought I'm going to have to he's going to go to school so now I can go to school, but also I can't require him to go to college if I don't go to college. I can't say you really got to go to college. So when he started kindergarten, I did my bachelor or my associate's degree. It was many years later, after working for many years as a health information professional, that I went back when my son was getting ready to start driving. I thought, gosh, I'm not going to drive him to practices and I'm not going to pick him up. What am I going to do with my time? Oh, okay, I'll go get a bachelor's degree in business. So I did. And then when he was getting ready to go to college, I was like, oh my gosh, I'm going to have empty nest. I'm going to be so terrified. What am I going to do with my time? And so, let's get an MBA. So that's what happened. And then that was in 2015. No, sorry, that was 2012. Well, 3 years later, my son married the most incredible girl. And right after the wedding, their wedding was in July. And right after their wedding, I was praying for purpose. I was like, Lord, what am I going to do with my time? And 2 weeks later, I was registered for my program in the doctoral program at NUSC. So yes, every time every time my son has a big rite of passage, I get a degree. So
Well, that scares me a little bit because I have one in elementary school and one in middle school. So,
stuff.
yeah, that's pretty scary. Well, one thing that you mentioned there around the association stuff, and that I think when you were at TNREC is when I was introduced to you. And I remember I was standing in Columbus, Georgia, and I called you and I said, I think I was the president or the president-elect or something like that at the time. And I called you and said, hey, would you want to be on the ballot and do this whole volunteer thing with me at Tennessee? And I mean, that's probably been, I don't know, 10, 15 years now.
Yeah. Yeah. It would be in 2011.
Well, and that kind of, pretty much tells you exactly the relationship Shannan and I have had is if one of us are traveling or in the car or we're bored and the phone rings, it's like, oh gosh, here comes something. We're about to come up with some crazy idea.
And they're always fun, even if they're not good ideas.
That's true. That's true. Absolutely true. Well, what do you think the goals should be for our podcast here?
Yeah. So first of all, to be in support of our profession. So for us specifically, in terms of any financial gains, it would be for THIMA Foundation. But for our professionals across the country, a place where health information professionals can come and listen in or participate by being a guest and talk about what are some of the challenges today that you're facing in your role as a health information professional. But what are some of the tech-enabled opportunities that can make it more efficient? What are some of the tech advancements that are going to happen or happening now that we need to be ready for? How do we prepare for governing AI-generated documents and health information? And then also, what have we? What are the new roles? So one of the things we'll talk about in an upcoming session is retailification, which is something that Seth and his business partner talk about a lot. And so thinking about retailification, that's a new kind of place for healthcare. So another thing is, where are new opportunities for health information professionals? Those things are goals that I have. What about you?
Yeah, well, I mean, that's retailification is a perfect example of a Tennesseeism that I mentioned earlier, where we just make up words. But the entry of retailers into the healthcare space it's happening, and it's coming fast. But there's a role for a health information professional in all of those, and being someone that is in a non-traditional, non-provider type role, working for a technology company, helping them through the traps and gates that occur in healthcare in the U.S. or in a government-led health system in Canada or the UK. they all operate the same once you get inside from a patient care perspective, but there are different things that you have to consider. So part of what I'm hoping to learn through this entire process is items that are outside of what I know. And I know my little patch, I know my little area. But as I mentioned earlier, I don't know that much about coding, and I don't know that much about data analytics and the things that you did at a payer. I don't know all these things. I'm not in it every day. So I'm hoping that from a goal perspective, we just have a diverse audience, a diverse set of guests, and we're all just in this thing together, just trying to figure out, all right, where are we all heading? We're all in this boat. Where are we going? What are you doing over there? What are you doing over here? And we're going to figure this thing out together. And we want to promote health information professionals, and we want to promote the health information profession. So I guess that would be an open invite. If you want to participate as a guest in this, reach out to us. Hit us on LinkedIn. You can email support@thima.org, and that communication will get to us. We'd love to talk to you. As you've probably seen so far in this, it's nothing formal. We're just having a conversation. We're just going to learn about what each other does and figure out some things, and maybe throw in a couple of made up Tennessee words in the middle of it.
That's great. Also, some of the things, if you want to email us, we love crazy ideas, just like he's talking about. Truly, we'll call each other, and it's going to be hey, it's never just and might be rude of us, Seth, but we never just call and say, hey, how's it going? I think that's because we call each other and say, hey, I had an idea. But we do that so frequently that we know how each other are doing, I mean, we do that by text message, but I guess maybe we should be better friends.
Yeah. Well, what's funny is I answered that phone call. I mean, a few weeks ago, you called me with a crazy idea. I'm walking down the street in Banff with my family up in Canada, and I was like, "Oh, Shannon's calling. I got to see what's happening. Something's good going." So it was a fun conversation. But we also have in the health information profession a large vendor community. So there's going to be opportunities for the vendors that support the health information profession and the industry to participate. We're going to have a couple of different options, and we'll figure it out as we go along. We're not quite sure how all that works, but as this thing continues to evolve, we're going to have different programs. So it could be as simple as a 30-second ad read, or a couple of those. We'll probably do an ad before and after the guest speaker, something like that. We may have co-sponsored episodes. Maybe a vendor doesn't necessarily want to have a full episode, but they can co-sponsor and do like a 15-second ad read. We may even invite vendors to have a fully sponsored episode, and they provide the content, the guest speaker, and hopefully it's a health information professional or someone that understands that process that can educate our industry. So we do invite our vendor partners to be a part of this. We want you to be a part of this. And if you've got questions on how to be a sponsor, again, reach out to us via LinkedIn, or you can email support@thima.org. And we want to welcome you in.
Yeah, very good. And while today's introductory podcast has really been very informal, which most of our conversations will be informal like that because that's just how we like to operate, there are serious conversations to be had on this podcast. They will be meaningful. They'll be meaningful to you as a professional. They'll be meaningful to your organization. And we hope that they make you think, right? Think forward about health information, about being a profession, about us being a profession, but also about your growth. And so while we're fun and talking and laughing a lot on this particular podcast, which we hope to do always, right? But
exactly,
there will be meaningful conversations about the state of things today in healthcare, things that are happening today that we're not quite prepared for, and things that will be happening in the future. We've got some great topics coming up.
Well, that's a perfect way to sort of tie a bow on our Introcast, our introduction podcast for HIPcast, the Health Information Professionals podcast. And Shannan, I'm excited about this, and we're looking forward to recording many more of these and starting this journey. So subscribe to our channels. I think we're going to be on the major podcasting platforms like Spotify and Apple Podcast, and we'll have the video version on YouTube. So I'm sure that they have. I always hear people when I listen to other podcasts, they're like, subscribe and turn on notifications and something. It does something with the algorithm. So whatever that thing does, do that for us, and we'll start posting. That way, when we start posting our episodes. So Shannan, it's always a pleasure, and looking forward to this journey. And we will see everyone on the next episode.
All right, very good. Till next time.